With that, I will welcome Dr. Molly Fleece, an assistant professor in the Division of Infectious Diseases, and Dr. Erin Delaney, a family medicine physician and the vice chair of clinical and quality affairs for the Department of Family and Community Medicine. They will discuss flu season, the latest COVID-19 updates, and more. Dr. Fleece and Dr. Delaney will both begin with a brief statement, and then we will open the floor up for questions. As always, please put your questions either in the chat or you can raise your hand through the reactions tab on Zoom. So Dr. Delaney, if you want to start off with your opening statements, that would be great.
Thank you. Good afternoon. Thank you for having me here today. Currently, what we're seeing in our office is still a good bit of COVID. These are coming in as types of sinus infections, sound like sinus infections and colds. Our numbers for COVID have started to go down just a little bit in the last week or so, but we are still seeing a good bit. We have not started to see much flu in our office yet, but I have had many more patients that have been much more eager this year to get their flu vaccines.
Perfect. Thank you so much, Dr. Delaney. And Dr. Fleece, did you want to start with some opening statements as well?
Sure. Good afternoon. So like Dr. Delaney said, across the state, we have still had quite the number of new COVID diagnoses per day, somewhere between 3,000 and 5,000 new patients diagnosed with COVID-19 every day. The numbers have started to decline very slightly each day, with a little bit fewer patients every day who have been newly diagnosed. That has also been reflected in the number of patients hospitalized. We have had just a fewer people hospitalized each day from COVID-19. Unfortunately, we have seen the number of patients across the state who have died as a result of their COVID illness go up over the last week. And so these are numbers that we are monitoring very closely. In terms of influenza, across the state as of last week, we have only seen 4 positive influenza B cases. It is still very early, and we anticipate that these numbers will go up sometime this fall and certainly the winter. So it is imperative that everybody do their part to try and protect themselves from both COVID and the flu by getting vaccinated.
Great, thank you so much. All right, so to begin, we're going to look at a few submitted questions that we have. So the first question is, so as we are going into this flu and COVID season, can you talk a little bit, maybe Dr. Delaney, can you talk a little bit about the safety of getting a flu vaccine and COVID-19 vaccine?
Yeah, certainly. So we do know that getting both your COVID and flu vaccines at the same time is safe, and certainly something that we recommend, especially for the convenience of it. If you haven't had your COVID vaccine yet, and you also need your flu vaccine, we're especially recommending that you just go ahead and get those at the same time. Based on what we know from other vaccinations and giving those at the same time, we feel that this is also a safe thing to recommend. And it is time to go ahead and start getting your flu vaccine. So we do highly encourage that.
Okay, great, thank you. All right, so Dr. Fleece, so like I said, we're going into this flu season, we're still in the pandemic. What are some things that we maybe learned last year from this similar situation that we can do to, like, how can we continue to protect ourselves this year? Taking the knowledge that we know from last year's experience, what are some steps that we can take to protect ourselves from flu and COVID this year?
Yeah, it's a great question. So last year, we certainly were battling COVID because of a few measures in place, like more people staying and working at home, more mask mandates. We did see less circulating flu. So this year, with more people returning to work and maybe fewer people wearing their masks out in public, we are expecting to see more cases of flu this year than we did last year. In order to protect ourselves, the first thing that we can do is get vaccinated for both COVID and the flu, as Dr. Delaney was mentioning. These vaccines can be used together. The flu vaccine is available now, and ideally everyone should get their vaccine by the end of October, but certainly anytime this fall and winter, if you change your mind, go ahead and get the flu vaccine in addition to the COVID vaccine. And then other measures that we are doing regularly. So if you are out in public, Wearing a mask can protect not only yourself and others. Washing your hands well and often. Staying home if you are sick. Very, very important to try and prevent the spread of any respiratory viral illness to friends, families, and coworkers. And then planning events accordingly. So going to crowded events if you are vaccinated or unvaccinated, thinking about times that you may need to wear a mask.
Okay, great, thank you. And as you mentioned, a good thing to do is to stay home when you're sick. So if you are experiencing either flu or COVID symptoms, what are some steps that you would recommend people take?
So if you do develop any symptoms that are indicative of a respiratory virus, and you may or may not know whether it is COVID or flu, like you said, stay home. So do not try and be the champion and go to work where you may expose others. Let your employer know that you are sick. Take care of yourself, get lots of rest. Try and sort out whether or not it might be COVID or the flu with testing. And so there are testing platforms that will be in place this fall and this winter that can test for both COVID and the flu. And that'll be important to help you not only protect those around you, but also have implications on different treatment options, as well as when you might be able to return to work.
Okay, great, thank you. And Miranda, I see that you have a question, so if you want to unmute yourself and ask your question.
Yeah, thank you so much. So I'm Miranda. I'm from the local national public radio station here, WBHM. And first, thank you so much for taking the time to chat with us. I guess, Dr. Fleece, can you kind of expand on that a little bit more about those different testing platforms that will test both the flu and COVID at the same time? I feel like that's something our audience would be interested in knowing a little bit more about. So if you could share any more information you have on that, that'd be great. Thanks.
Yeah, so there are a couple of different testing platforms that we are familiar with now. They are nasal swabs or nasopharyngeal swabs like we are using currently for COVID, similar to what we do each year for flu testing. The advantage of these types of platforms are that they can test for both COVID and the flu at the same time. So it's not two different swabs. It can be done just with one swab, and the results can come back at the same time. These tests will likely be widely available in hospitals and in different physicians' or doctors' offices, and I think will be really helpful this fall and winter as we encounter probably potentially another surge of COVID, as well as increasing cases of flu this year compared to last.
All right, thank you. Chastity, if you want to ask your question.
Thanks, Hannah. And doctors, thank you so much for doing this again today. My question is about knowing the difference between COVID, flu, and allergies, because obviously we have ragweed that's starting to flare up. I know I personally am suffering from that. So how would people know which one they're suffering from and when they need to go in and get tested?
Dr. Delaney, do you want to try to take this one?
Yes, I'd be happy to. So you're exactly right. Here in Alabama, with all of the things blooming and out right about now, it is really confusing to know which one you're suffering from. So certainly allergy type symptoms, sinus type symptoms, even the symptoms from COVID and influenza, they're all fairly similar. So as we've seen, COVID symptoms can be very variable from person to person. And so it is difficult to tell. Same thing with flu. There's a lot of overlap between COVID and flu. So primarily with the flu, we do see fever, headache, and cough being the predominant symptoms. You don't tend to see the loss of taste and smell with flu that you do see with COVID. But COVID does have those same symptoms with fever, headache, cough, and then as well as the sinus symptoms. So because we can't tell all the time just based on symptoms alone, we are relying a good bit on some of the tests that Dr. Fleece mentioned to help kind of tweeze out which one is affecting you. This is really important from a public health standpoint, because if you think you have allergies and you go to work, but come to find out you actually have COVID, the risk of other people or spreading it to other people is high. So the only way to really know is to have the testing done.
Okay, great. Thank you. And with Bobby has a question. So with limited flu cases last year, are flu symptoms expected to be more severe this year? And let's say, Dr. Fleece, would you want to take that one?
Yeah, sure, happy to. So I don't think flu symptoms are expected to be more severe this year, but it's important for people to remember that the flu every year is an important viral illness. It makes people sick, it puts people in the hospital, it keeps people out of work. And so keeping that in mind a little bit to the top of the mind this year than maybe last year, getting your flu shot will be especially important this year. I think symptoms will be about the same as it is every year. So like Dr. Delaney said, fever, myalgias or muscle aches and body aches, cough, shortness of breath, all are potential symptoms that one may have. Another difference between influenza and COVID have to do when you potentially can spread the virus onto others. So as we know, and we've talked about a lot with COVID, you're potentially infectious for many days, potentially out to 20 days after you get infected if you have a weakened immune system. Whereas with flu, it doesn't last all that long. You may be infectious for maybe a week or so. Symptoms too are a little bit different in terms of how long they last. Flu symptoms typically last maybe 5 to 7 days, potentially longer, potentially shorter if you are vaccinated, whereas we know COVID symptoms have the potential to last even longer. So I think more important than ever this year, thinking about that flu shot, talking to your medical professional and medical provider about the flu shot if you have any questions, and going ahead and getting it early this flu season will help protect you, protect your loved ones, protect those that you interact with on a daily basis from flu as well as from COVID.
All right, Miranda, I see that your hand is raised. Do you want to go ahead with your question?
Yeah, thanks. So, pivoting to children, especially those that are younger than 12, they're not eligible for the vaccine, at least at this point. So what would you all say about making sure that they get their flu vaccine, at least if they can't get their COVID vaccine? If you could talk about that a little bit, I'd appreciate it. Thanks.
Dr. Delaney, do you want to talk on that a little bit?
Yes, I'd love to. So you're exactly right. Because this age range is more vulnerable right now while they are awaiting approval for the vaccine. We do want to think about all of the other measures that are available to help protect this age group. So certainly vaccination for the flu is really important to protect them from this potentially harmful virus, as well as all the other measures. So masking, social distance, good hand washing. I think all of those things become really important when we're trying to protect them from COVID, but also from flu, because we would love to have another season where we didn't see as much flu as well.
All right, and then kind of coming off of that, so can you tell us a little bit, so to protect your children, you recommend getting the flu vaccine. So can you tell me a little bit about CDC guidance for children and flu vaccines? What's the earliest they can receive it? Do they need a booster if they're getting it for the first time? Can you go into detail about that, Dr. Delaney?
Yeah, sure, I'd be happy to. So children 6 months and older are eligible for the flu vaccine. When it is your first vaccination, you do require 2 doses. So we do recommend that those vaccines, that you start those fairly early in the season, so at least by October, so you can get in that second dose to have full immunity. So like I said, 6 months and older are eligible for that vaccine. And again, highly recommended.
All right, thank you. Okay, and then can you talk a little bit about pregnant women getting the flu vaccine? Can you go into detail and talk a little bit about that, Dr. Delaney?
Sure. So we do also recommend vaccination for pregnant women for the flu. They are eligible for the same vaccinations as long as it's according to, the recommended for their age range. So we do fully support and recommend flu vaccination for pregnant women.
All right, great. Thank you. And Chastity, if you want to go ahead with your question.
Thanks again, Anna. Just a point of clarification about the flu shot again. You said that if it's your first time getting it, you need to get a 2-shot series. But what if you've had one in the past and say it's been a few years since you got one? Do you need to get 2 shots again, or is it just the 1 shot?
No, it's just the 1 shot.
All right, great. Chastity, do you have a follow-up to that?
No, that's good. That was just a point of clarification. Thank you for that.
You're welcome. All right, Miranda, you can go ahead with your question.
Thank you. Okay, so I know that you guys both have mentioned multiple times that it is okay to get your COVID shot and your flu shot at the same time. Naturally, I feel like as we get into flu season, we're going to see that a lot more of, no, you can't, no, you shouldn't. So can you give us any maybe misinformation you guys have heard online or seen or anything along those lines, and anything we can do as journalists to help clear that up in regards to flu shots relating to COVID shots and getting them at the same time?
Dr. Fleece, do you want to take that one?
Sure. I'm trying to think about other misinformation that I've seen or heard lately. I think the biggest takeaway is that vaccines in being administered together is something that's been looked at over time historically. So whereas the COVID vaccine will be available, I guess, for the first time this year in conjunction with getting the flu vaccine, putting 2 vaccines together at the same time or administering 2 vaccines at the same time is not new. It is something that I would certainly do if I were not already vaccinated for COVID. And I would encourage and do encourage all of my patients to go ahead and get both vaccines if they have not already had their COVID vaccine to date. I think the biggest recommendation that I would have is if anyone does have any concerns, that they get their information and their facts from a reliable source. So speak to your healthcare provider, talk with your physician or nurse practitioner or APP about your concerns. Let them help you by answering your question and giving you the best source of data and information to help drive your decision. Try to shy away from the school of public opinion, whether that's on Facebook or social media, where unfortunately misinformation is running rampant and has resulted in loss of life, essentially, with people receiving that misinformation, trusting it, and having the worst outcomes possible as a result of that.
All right, thank you. And Dr. Delaney, this one is a question for you. So is it safe for people to see their primary care provider and get their routine screenings during this time? What are some advice that you would have for people that might be concerned about the safety of that right now?
Yeah, that's a great question. So we do feel it is safe to come into the office. Many offices are changing protocols in terms of when maybe they would see sick patients or how they would see sick patients. For example, maybe they choose to do telehealth only for those patients that are having symptoms to keep those patients separate from those coming in for routine checkups, annual physicals. Some practices will have well exams in the morning and sick visits in the afternoon, and in order to separate those patients so we don't contaminate. And then also, most offices are doing a great job at cleaning and disinfecting. All of the staff are wearing masks and face shields and appropriate PPE. So I do feel like it is very safe, and our patients have just been wonderful at also wearing their mask and helping waiting rooms, for example, to stay safe as well. Waiting rooms are still socially distanced to minimize the exposure for patients too. So we certainly feel it is safe to come in, and we really want our patients to come in and not forego those routine screenings and preventative measures.
Right, great, thank you. And then one question that I think both of y'all can answer. So as we're going into the fall, we're looking ahead to football games, we're looking ahead to holidays. What is some advice that you would have for people that want to try? What's some advice you would have for people who are trying to enjoy these activities this fall, and how could they enjoy them safely? And this can be, if y'all both have something to say about that, that would be great. Dr. Delaney, if you'd like to start.
Yeah, sure. So I think that it will still require some creativity in how we think about our traditional holidays and gatherings. I do still feel like large crowds are potentially dangerous in terms of spreading COVID and flu. So I would think about other options, maybe, watching a sporting event on your TV with just a couple of close friends that you perhaps know have been vaccinated, and you're able to not sit quite so close as what you might be in a stadium. So I think it still is going to take some creativity this year in thinking about how we gather as friends and family. I think it brings, it offers us a great opportunity to encourage our friends and family to get vaccinated if they're not already vaccinated for COVID and the flu. So using that as an opportunity to suggest and recommend, we would love to have you. It would be even better if you could come vaccinated to prevent that risk there. So I think it gives us that chance to have that conversation with our friends and family. And so I do still think we'll be able to do some fun things with friends and families over the holidays. It'll just take a little bit of extra planning.
All right, great. And Dr. Felice, did you want to add anything to that?
I agree with everything that she said. I think the creativity part is important. And I think living in Alabama, we are lucky that we have a fairly mild fall and mild early winter. And so thinking about options for still outdoor dining around Thanksgiving if the weather remains warm, and enjoying some of those football games with your close group of family or friends, potentially outdoors around a TV as well. So I think this year we have the advantage of going into the holidays with the wonderful promise of the COVID vaccine that we were so hopeful for last year, getting everyone vaccinated, which happened a little bit after the holidays. This year we have the vaccine, so I would encourage everyone to use this vaccine that we have that is helpful. It's helpful to prevent people from getting sick, keeping people out of the hospital, so that way we can enjoy those friends and family gatherings this fall and winter as safely as possible.
Great, thank you both. Miranda, do you want to ask your question?
Yeah. Okay. One last question. I always have more questions, so I appreciate y'all answering them. But Dr. Felice, to follow up kind of what you had said before about it's not new, vaccines have been administered together over time. Can you kind of pivot back to that and tell us, a couple of those examples, different vaccines that have been paired together and given together over time, and how it's not new having flu and COVID at the same time? If you could just go into depth about that, that'd be awesome. Thank you. Sure.
So it's not uncommon when you are going to potentially one of your routine medical visits. For example, if you were due for your pneumococcal vaccine at the same time that maybe your tetanus booster is due, being able to get both of those vaccines at the same time has been looked at for many years and has been safe. And so there is nothing that makes the COVID or the flu vaccine different where those two could not be administered at the same time or in the same visit. So I would encourage everyone to talk to their medical provider about it, ask their experience as we go into the fall flu season, and then to, again, get their sources of information from reliable sources, and feel comfortable with getting both the COVID vaccine and the flu vaccine at the same time.
Thank you.
All right, great, thank you. And then, so a lot of people at this point are experiencing COVID fatigue. We've heard that term a lot lately. What is some advice that both of y'all have for people who might be experiencing that? Dr. Felice, if you'd like to start.
Sure. So I think all of us at this point are having COVID fatigue. It's been a long, tough road for many people emotionally, physically, mentally. Just hearing about COVID, seeing the repercussions of this illness around us for the last, 18 plus months at this point. So I think taking care of yourself is really important. Listening to your body, making sure that you are listening to your needs, caring for yourself, caring for your family, asking your friends, families, neighbors how they're doing, and offering that support. I think from a health perspective, taking care of your health in the midst of COVID, like Dr. Delaney was saying, go to your routine, regular primary care visits for your annual screenings and annual check-ins with your provider to make sure that you are up to date on all of your other medical needs. And then in terms of protecting yourself and others, getting vaccinated is one way that you can protect yourself from getting sick, which will also help with that COVID fatigue if you yourself do not get sick.
All right, great. And Dr. Delaney, do you have anything to add to that?
Yeah, I definitely agree with Dr. Fleece on those things too. I think that going back to some of the things that we mentioned about how we can safely gather for the holidays and with friends and family, I think using some of that, when we are feeling the COVID fatigue, it's inevitable almost, using some of that same creativity to do things that you still enjoy. So maybe it's having an outdoor conversation with a neighbor or a friend, still, meeting up with people and having some of that socialization, I think is really important and can energize us to keep doing these things. So I think that contact is important and remembering to do things, like Dr. Fleece said, to take care of yourself. I'm also really inspired and encouraged by my children personally. They have done an incredible job last year wearing masks in school, and they are back at it now. And they don't seem to mind at all. They just put their mask on and go. And I have to remind them when they get home, you can take your mask off. Otherwise, they just keep wearing it. So seeing them do it is just kind of a healthy dose of, well, we can all do this. We can get through this. So they're great examples.
Well, great. Well, it doesn't look like we have any more questions. Okay. Yeah. Okay. So we do have one more question that just came in from Bobby. Can you all talk a little bit about the risk of having both flu and the COVID virus at the same time? And Dr. Fleece, you want to take that one?
Sure. So both COVID and the flu are respiratory illnesses. They, as we've said, have similar symptoms that you may present with, but both have the potential to make you fairly ill. Historically, in flu seasons, we've talked about the number of cases in the tens, thousands, hundreds of thousands of cases around the country in the midst of flu season. In that, we talk about the number of people who are in hospitals, the number of people in the ICUs, and the number of people who unfortunately die from the flu. So the potential to have both a severe flu season and a severe COVID season or COVID surge this fall and winter is one that we do worry about. And so that's why we are harping on vaccinations and masking and distancing as a way to protect ourselves. Since they both have the potential to cause a severe pulmonary illness, you may end up severely ill in the hospital with pneumonia. They both every year have caused patients to end up on a ventilator. And so if you do get infected with both the flu and COVID at the same time, that is also a possibility. And from a public health perspective, we're talking about more strain on the healthcare setting as well. So more people influx into the hospital with this respiratory symptoms, more people requiring mechanical ventilation, life support, if you will. So I think the possibility of having COVID and flu at the same time is concerning, but the bright spot of all of this is that they both have vaccines available. So really, really important to get both vaccines this year.
Okay, great. So I think that is all the questions that we have. Thank you all again for joining us today, and we will be sending a recording out shortly.